Hi there.
Hi.
Good morning, good afternoon, good evening to everybody. My name is Malka Stromer.
And I'm Janine Noble.
And we're from Sound Sports Imaging, and we are going to be presenting shoulder scanning protocol. If you have an ultrasound machine, please feel free to scan along with us. We'd like to introduce our lovely model here. This is Anna. So please welcome Anna, and her beautiful shoulder is going to be displayed to you today.
All right, welcome. If you don't have a transducer, one thing you can actually use is your cell phone and practice. It's about the same size, and it'll give you some idea of what you're scanning. We're going to start with the shoulder has several different tendons, ligaments that we look at when we're scanning. And we follow a set protocol when doing this. I go through, and this is a general protocol that most everyone uses. It'll be biceps tendon, subscapularis, supraspinatus, infraspinatus / teres minor, and AC joint. And we have everyone we put into a different position to get the tendon on its longest point. It's kind of like a rubber band. If the rubber band is loose, you can't see what's going on. When it's taut, you can see any little micro tears that are in there. And we do the same thing with this. And I've got a little saying that goes along with each position. And it comes from a friend of mine from Colorado who's been doing MSK for a lot of years. And we'll run through it. So this will get you through biceps. It's, do you have any money? That first biceps tendon, I don't know. For subscapularis, because you're putting it on external rotation, let me check. For supraspinatus, going into your back pocket, checking your wallet. And yes, I do. You're going to pat yourself on the back because you do have some money. And then back to neutral for the AC joint. So we're going to start on her shoulder. Now, one thing you want to start with is to make sure this shoulder is free. People will try and pull a shirt up, but it doesn't give you enough room to actually see what you need to. So I'm going to take her. You can gown the patient, make a little toga here. She's agreed and she's okay with pulling the shirt down to keep this shoulder open. And I'm going to run through how we would do a scan, and then we'll flip over to the ultrasound image so you can see what it is. So I'm going to put her palm up. And the reason the palm is up is if palm is down, your elbow tends to go out. And we want to keep this close to the as close to the body as possible. You can palpate where the bicipital groove is. And I'm going to go directly over it here. So I am in a short axis view through here. And I'm going to scan down to about the pec major attachment off on the biceps, come back up. And then go into rotate this 90 degrees. I'm going to turn you this way just a tad. Yeah, I'll have you stand up just a second. There we go. Thanks. So now you can see we've gone from a short axis view into a long axis view. And when you're first starting this, the better way to do this, instead of looking at the screen and trying to maneuver this, just figure out where you are. If you've got the best picture here, just look at the transducer and rotate it 90 degrees, and that will get you pretty much where you need to be. Then for subscapularis, go back to the transverse biceps. This is, do you have any money? I don't know. We're going to have her externally rotate, so you'll see the lesser tuberosity in through there, and we can check in this position to look for biceps subluxation or dislocation, and also the integrity of the subscapularis. Once she's in external rotation, we'll rotate 90 degrees and get a view of the short axis of the subscapularis. Okay, so third position, do you have any money? I don't know. Let me check. So I'll have her go into her back pocket. I'm going to come at a 90 or 45 degree angle, kind of from the ear down, and start in here, starting medial and coming lateral until we get to the supraspinatus tendon, which we'll show you in a few minutes. From there, I'll rotate 90 degrees to get the short axis of the supraspinatus. then back around. She has money. She's going to pat herself on the back or the shoulder. I'm going to look at infraspinatus starting parallel to the ground and lateral, and following this posteriorly, doing external rotation as we go along. For AC joint, we'll be doing a long view across both bones at the AC joint. So we'll have clavicle in the middle, on the left side of the screen, and acromion on the right. Okay, we're going to switch now to the ultrasound view of this so you can see what's going on. There we go. Okay, a couple of things I'm going to show you here. Changes that we're going to make changes we're going to make on here are gain in this knob right here. Oh, to make it brighter or darker. And then we'll go down to, or over to depth to make the picture bigger or smaller. This is a personal preference. It depends on the size of the patient, but generally we're going to start at about a 4 centimeter depth. So, do you have any money? Right over the biceps tendon, I have the notch, which corresponds to the left-hand side of the screen, on facing medial. This will be on the left-hand side. All right, so once you're here, top of the screen is the skin surface. Below that is deltoid muscle. And again, we're taking a slice through the shoulder here. This is a cross-section or short axis view. The bicipital groove and the biceps tendon in the middle of the groove. Now, one thing that is unique to musculoskeletal ultrasound, and we learned this and we did in the physics portion, is anisotropy. If we are not perpendicular to the fibers of the tendon, see how the biceps looks black? We're not on axis with that. So you can create pathology, which you don't want to do. The doctors don't like that. So we're going to scan down through this distally to the pectoralis major attachment. Go up a little, right through there. And then back up to the short axis. I'm going to look at the transducer, rotate this 90 degrees. And now we have a long axis view of the biceps tendon. Humerus and biceps tendon just above it. I'm going to track that down. Tendons and ligaments look like rope. They're long fibrous structures. Deltoid muscle above that and skin surface. All right, biceps tendon. Now we'll go to subscapularis, which will be the anterior muscle right here. So we have on the bicipital groove, the greater tuberosity to the right of the screen, where the supraspinatus will come through, the lesser tuberosity on the left-hand side. And if you're in the right position here, you'll already see the subscap coming in. I'm going to externally rotate her, and there's the subscapularis in a long axis view. The greater tuberosity is to the right. That is the tendon. It has a bird's beak appearance. It looks like a little beak coming down. I'm going to go a little medial and superior. And now we have the coracoid coming in to the left right there. And I'm just going to internally, externally rotate her. Tendon looks good. No impingement through there. Anterior glenohumeral joint is in that space to the lateral side of the coracoid. Okay, go back to this long axis. I'm going to rotate this 90 degrees. Now we have a short axis view of the subscapularis, and it's a multi-pennant tendon. So you'll see the little bundles within that. That's perfectly normal. I had a tendency at first to think that that was cherry in there, but that is the composition of that tendon, so that is normal. Now we're going to have her check her pocket. Hand behind your back, please. Thank you. Going to start in a 45-degree angle here. On the bone, I'm going to start medial and come lateral. And look what comes into view. You have the greater tuberosity right through there. The tendon is above it. And bursa is the little black space higher, right there, in between the subdeltoid fat and the tendon. Now that is a really little space. It's considered a potential space. So if there's no fluid in it, you're not going to see anything. And fortunately, she has no fluid in there. So we're finding good news for her all the way around. I'm going to scan through this. Keeping in mind, the beam is only the size of a credit card. So you want to go the entire width of the tendon. Then I will rotate this 90 degrees. We're now in a short axis view. The long view looks like a bird's beak. The short axis view looks more like, I call it a rainbow, or if you're a guy, it's a radial tire. Humerus along the bottom, tendon above that. Coracoid off to the left. And biceps is down in the corner, right, a little to the right there. Right down in there is the biceps tendon. This way you know you're in the correct position. Okay, I'm gonna come back out, hand across the body. Infraspinatus, I like to start with the notch toward the back, parallel, the transducer will be parallel to the ground and horizontal. And start low. There is your infraspinatus, the insertion. I'm gonna come posterior, following the bone, kind of hugging the body with the probe, so that when we get to, oh, and I'm going to add just a little more gel here. So humerus, following it posterior. I'm going to change the depth. Whoop, the other way. Into the posterior joint. Now I'll externally rotate her. You can see where the humerus comes down. The labrum will be in that little V right there with the glenoid to the left. So you can look for impingement in through here of fibrosis, calcifications in through there. And then the infraspinatus muscle, we'll see it moving. Okay, back to a neutral position. I'm going to go across the bones to see both bones here. We have clavicle to the left, acromion to the right. Now this is, she does have a little bit of spurring down in there. You can follow this lateral over with the acromion and then the humeral head to the right. The supraspinatus is above that, and I'm going to just abduct her, looking for impingement, but this moves pretty good. And then back to the AC joint. So this is a shoulder exam. It goes very quickly. If you're limited on time when you're first starting, you can do biceps, supraspinatus, and AC joint. Those are the ones that tend to have the most pathology. If you have any questions right now, we'd be happy to answer them.
All right. Thank you for joining us today, the shoulder scanning protocol. Please be aware that next week we are having a webinar with regards to AAA screening, abdominal aortic aneurysm screening, followed by the week after a knee scanning protocol. Remember, here at Sound Sports Imaging, we provide solutions to all your ultrasound needs.
And if you have any questions at all about any of our webinars or questions you'd like to ask, please feel free to email us at info@soundsportsimaging.com.
Have a great day.
Thank you.